Hi, my name is Anel, and today we're going to be talking about deadly diphtheria. So, what is diphtheria? It is a very serious infection caused by strains of bacteria called Corynebacterium diphtheriae. This strain of bacteria makes a toxin. This toxin can make people very sick because it spreads throughout the rest of your body. Taxonomy and characteristics of diphtheria. I apologize in advance for my pronunciation of some of these terms. Domain, bacteria. Phylum, Actinobacteria. Order, Actinomycolates. Family, Corynebacteriaceae. Genus, Corynebacterium. Species, C. diphtheria. Some of the characteristics of diphtheria is that it is aerobic. It's a gram-positive bacteria. It is non-motile, non-encapsulated, non-sporulating, and the shape of the bacteria is a series rod, as you saw in the previous picture, but I'll show you again what that looks like. Here you can see they kind of look like little rods all over the place. So that's just a sample of the bacteria. So what are the symptoms of diphtheria? So we have pharyngitis, which is basically a sore throat. And we have this thick gray membrane covering the throat and the tonsils, as you can see in the picture. That is the most unique symptom for diphtheria, which is kind of like how they know that it's diphtheria, because that thick gray membrane kind of looks like white leather on your throat. It's very abnormal, and that's how they can identify that that's that kind of bacteria. We also have fever and chills. We have the difficulty breathing and rapid breathing. We have hoarseness, which is basically abnormal voice changes, obviously due to the membrane on your throat. We also have swelling of the neck if it's really bad. Also area surrounding the skin lesion. And the toxin is distributed to distant organs by the circulatory system, which is why this disease can get really deadly. And because of this, it could lead to paralysis and congestive heart failure, which is obviously pretty serious. So what are the origins of diphtheria? There are reports that document the disease back to ancient Greece and Egypt. There were a lot of people that would report these membranes on the throat, but nobody could connect that it was the same thing. So there were multiple reports of diphtheria, but nobody could put two and two together to realize it was the same disease, so nobody knew how to fight it. It formed where there was poor hygiene and crowded conditions. And it was also known as the children's plague since it mostly affected children under the age of 5. So it was basically a death sentence. During the 1700s, there were severe recurrent outbreaks in Spain, Britain, Germany, and in the New World. So obviously this was the time of exploration, which is why the disease spread so quick. And because of these outbreaks was why people started to look more into what the disease was. It didn't get properly studied till the 1800s by a French physician called Pierre Berthelot. Imagine this is what he looks like. And the name of the disease comes from Greek word diphtheria, which means leather hide. So as I said before, when the patient opens their mouth, the tonsil area, the thick membrane kind of looks like white leather, and it looks like if you were to pass your finger through it, it would feel just like leather, which is where it got the name. So transmission. Just like most disease nowadays, it usually spreads from respiratory droplets, although it could also be spread by secretion or direct contact, touching anything that could be contaminated with the bacteria, which is why it is so easy for it to spread, because obviously we don't see bacteria. An infected person, unless treated with antibiotics, is infectious for 2 to 3 weeks. 2 to 3 weeks is a long time. You could infect a whole town in 2 to 3 weeks. Especially if you don't know you have it, because unless you look inside your throat or the symptoms are really bad, most people have it aren't perceived that they have it. They don't get tested or anything for it, which is why it spreads so quick. Treatment. So treatment didn't become available till the 1920s, when there was more of a understanding of what this disease actually was. And they found that putting the patients in isolation for the first few hours meanwhile antibiotics kicked in was the best way to not also help the patient but save lives. The antibiotics to kill the bacteria, and they stop it from spreading to the rest of the body, obviously saving lives. The antibiotic mostly that they use is erythromycin, 40 kg for 14 days. They also give an antitoxin to neutralize the toxins secreted by the bacteria. So prevention. Obviously, with the great blessing that we have nowadays, we have a lot of technology and medicine, there is a vaccine to fight diphtheria. The diphtheria vaccine is a bacterial toxoid, a toxin whose toxicity has been inactivated, and it's usually given mixed with other vaccines, which is why most people have it. And the latest version of the vaccine is known as DTaP for children and TDAP for adults and adolescents, and it provides protective immunity against the disease. With prevention also comes the booster shots, because this immunity to the disease does fade. So the first booster shot is around age 7, and then 10 years later with 10-year intervals. And it is important, especially if you're in an area where diphtheria is common to reoccur. So as you can see here in the picture, it's DTaP for young children, 2 to 6 months, 15 through 18 months, 4 to 6 years, and then TDAP for preteens, 11 through 12 years, TD or TDAP for adults every 10 years. So this is a graph that shows the diphtheria cases reported throughout the years. As you can see, 1981 we had the highest peak, and it starts going down till we get to 1993 and 1995. There was kind of a small outbreak, especially in the area of Africa. We'll see in a little bit in the graph. And then it's gotten down since, and there hasn't been that many cases reported. As you can see, in 2017, it does go up a little bit, and I will show why it does. This is another graph, and this shows the diphtheria cases reported throughout the years also, but it gives the regions that the cases are most reported in. So the thick bold line is the worldwide total. Then we have Southeast Asia region, which is like the most common area where diphtheria does reoccur. We have Africa, Europe, the Western Pacific region, the Eastern Mediterranean region, but as you can see, the most important part is that the area where diphtheria does reoccur mostly is the Southeast Asia region, especially in the areas of Africa. So where is diphtheria currently? The vaccine has reduced dramatically the mortality and morbidity of diphtheria. I wouldn't say it completely has gotten rid of the disease throughout the world, because it hasn't. But because so many people do have the vaccine, especially in North America and South America, the disease, when it does have outbreaks, it is not in this side of the world. It's more in the areas of Africa. So it is still a big issue in countries with poor EPI coverage, places where it's common. There are usually sporadic cases or small outbreaks because, like I mentioned before, it's a really easy disease to pass on without one even noticing, kind of like COVID. And it is fatal in 5 to 10% of the cases. And obviously the higher mortality rate is in younger children, because younger children mostly do not survive this heavy-duty disease. So this is the most beautiful graph ever. This shows the coverage that the vaccine has provided throughout the years. So it starts in like 1981, and it's kind of a GIF, so it moves and shows throughout the years how the color changes throughout the different regions. So you can see that most North America is blue, South America blue. So the areas that are red are areas that don't have vaccine coverage, or where there are small outbreaks because there aren't that people vaccinated, or one person gets diphtheria, contaminates another person. And as you can see, it starts over, so you can kind of see how it progresses with the years. In conclusion, the disease is very deadly if you do get it, especially if you're under the age of 5. But right now, it's not a big issue because numbers have gone down significantly because of the vaccine, and because we know how to treat it better. There isn't that many deaths to it anymore.